Varicose eczema, also known as venous eczema or stasis dermatitis, is a skin condition that occurs in individuals with chronic venous insufficiency (CVA), a condition in which the veins in the legs do not efficiently return blood back to the heart. The poor circulation and increased pressure in the veins of the lower legs lead to various skin changes, including eczema. It is a common condition in people with varicose veins or other forms of venous disease, especially in older adults. Causes of varicose eczema. Varicose eczema is caused by the combination of poor circulation due to venous insufficiency and the resulting buildup of fluid and waste products in the tissues of the legs. Over time, this increased pressure in the veins can cause fluid leakage. High pressure in the veins can cause fluid to leak out into the surrounding tissue, leading to swelling, edema, inflammation. The body responds to the fluid accumulation by inflaming the skin, which can lead to skin irritation and changes in texture. Reduced oxygen supply to the skin. When blood flow is impaired, the skin cells do not receive adequate oxygen and nutrients, which can weaken the skin and make it more prone to damage. Risk factors. The following factors increase the likelihood of developing varicose eczema. Chronic venous insufficiency (CVA). Individuals with venous disease or varicose veins are more likely to develop varicose eczema. Age. It is more common in older adults, especially those over 50. Obesity. Extra weight puts additional pressure on the veins of the legs, contributing to poor circulation. Pregnancy. Hormonal changes and increased pressure on the legs during pregnancy can contribute to venous insufficiency and varicose eczema. Sedentary lifestyle. Prolonged standing or sitting without movement can impair circulation and increase pressure in the veins. Family history. If you have a family history of varicose veins or CVA, you may be at higher risk. Injuries or trauma to the legs. Previous leg injuries can contribute to impaired circulation and increase the risk of varicose eczema. Symptoms of varicose eczema. Varicose eczema usually affects the lower legs, especially around the ankles. Common symptoms include itching. One of the most common and bothersome symptoms of varicose eczema is intense itching. Red or inflamed skin. The skin may become red, inflamed, and irritated, particularly around the varicose veins. Dry, flaky skin. The skin may become dry and scaly, often with a rough texture. Cracked or weeping skin. The skin may crack, weep, or ooze clear fluid, leading to an open wound. In severe cases, this can lead to infection. Discoloration. The skin in affected areas may become darker brownish or reddish, particularly around the ankles, due to iron from red blood cells being deposited in the skin, the condition called hemosiderin staining. Swelling. There may be visible swelling in the lower legs, especially in the feet, ankles, or calves, due to fluid buildup. Thickened skin. Over time, the skin may thicken and become leathery, a condition known as lipodermatosclerosis. Leg ulcers. In some cases, chronic varicose eczema can lead to painful leg ulcers that are slow to heal. Diagnosis. The diagnosis of varicose eczema is typically based on physical examination. The doctor will examine the affected areas of the skin and look for signs of venous insufficiency, e.g., varicose veins, swelling, skin discoloration. Medical history. Your doctor will ask about your medical history, particularly any history of venous disease, varicose veins, or circulation problems. Ultrasound. In some cases, a duplex ultrasound may be used to assess the blood flow in the veins of the legs and identify any underlying venous insufficiency. Treatment of varicose eczema. Treatment for varicose eczema is aimed at managing both the skin condition and the underlying venous insufficiency. The main goals of treatment are to relieve symptoms, prevent further damage to the skin, and improve circulation. Treatment options include compression therapy. Compression stockings or bandages are commonly used to help improve blood circulation in the legs. These help reduce swelling and relieve pressure on the veins, which can reduce the severity of eczema. Compression stockings are typically worn throughout the day, and they should be properly fitted to ensure they are effective and comfortable. Topical treatments. Moisturizers. To prevent dryness and soothe the skin, regular use of emollient moisturizers is recommended. Choose fragrance-free and gentle products to avoid further irritation. Topical steroids. Mild to moderate strength corticosteroid creams or ointments may be prescribed to reduce inflammation and itching. However, long-term use should be carefully monitored by a doctor, as excessive use of steroids can cause skin thinning. Calcineurin inhibitors. In some cases, non-steroidal anti-inflammatory creams like tacrolimus or pimecrolimus may be used to reduce inflammation and control eczema symptoms without causing skin thinning. Wound care. If the eczema causes skin breakdown, sores, or ulcers, proper wound care is essential to prevent infection and promote healing. This may involve cleaning the wound, applying specialized dressings, and keeping the area elevated. Antibiotic creams may be prescribed if there is a risk of bacterial infection. Leg elevation. Elevating the legs above heart level when resting can help reduce swelling and improve circulation. Aim to do this several times a day for at least 30 minutes. Sclerotherapy or surgery. If varicose veins are a significant problem, sclerotherapy, injection of a solution that causes the veins to close off, or surgical treatment may be recommended to improve blood flow in the veins and reduce the risk of further complications. Lifestyle changes. Exercise. Regular physical activity, such as walking or swimming, can help improve circulation and prevent fluid buildup in the legs. Weight management. Maintaining a healthy weight can help reduce pressure on the veins and improve circulation. Avoid prolonged standing or sitting. Try to move around every 30 minutes to help maintain proper blood flow in the legs. Prevention of varicose eczema. To prevent or manage varicose eczema effectively, it's important to take steps that reduce the risk of venous insufficiency and promote circulation. Wear compression stockings. These can help prevent varicose veins from worsening and reduce the risk of developing varicose eczema. Exercise regularly. Activities like walking or swimming can help improve circulation and reduce swelling. Elevate your legs. Elevating your legs can help reduce fluid retention and ease the symptoms of venous insufficiency. Maintain a healthy weight. Reducing excess weight can lessen the pressure on the veins and improve circulation. Prognosis. With appropriate treatment, varicose eczema can often be managed effectively, especially if caught early. However, the condition can be chronic, and flare-ups may occur, especially if the underlying venous insufficiency is not adequately managed. In severe cases, complications such as leg ulcers may develop, which can be difficult to treat and may take a long time to heal. It is important for individuals with varicose eczema to follow a comprehensive treatment plan that includes managing the underlying venous disease, as well as taking steps to protect and care for the skin. Conclusion. Varicose eczema is a common condition in individuals with chronic venous insufficiency, especially those with varicose veins. It can cause itching, skin inflammation, discoloration, and even leg ulcers. Effective treatment focuses on improving circulation, managing the underlying venous disease, and caring for the skin. Compression therapy, moisturization, topical medications, and lifestyle modifications are key elements of treatment. If you suspect you have varicose eczema, or if you experience symptoms like leg swelling or persistent skin changes, it's important to consult a healthcare provider for diagnosis and appropriate treatment.